I recently heard from my mom, who's 68, that on the inside she feels very young, but when she looks in the mirror, she sees someone much older and doesn't even recognize herself. It's a common feeling. Young in spirit, but your skin can't keep up. That's why I'm making this video, to give you a concrete action plan on how to comprehensively care for mature 50+ skin, so you can look on the outside the way you feel on the inside. What happened to your skin that makes it so different than before? Why do you suddenly see a different face in the mirror than you did just a few years ago? Imagine you're running downhill. At first, you control every step, but with each passing meter, you pick up speed until finally, you just can't stop. That's exactly what skin aging is like after 50. It's a process that starts slowly, but then it really picks up speed. From about the age of 30, collagen production starts to decline. And after menopause, this process accelerates dramatically. Research shows that within the first 5 years post-menopause, a woman loses up to 30% of her skin's collagen. After that, it decreases by another 2% each year. On top of that, there's the degradation of elastin fibers, known as elastosis, which causes the skin to lose its springiness and start to feel looser to the touch. After the age of 50, the sebaceous glands slow down their sebum production. The skin has a harder time retaining water, becoming drier and more sensitive. Fewer melanocytes make the complexion look pale and thin, while at the same time darker spots and discolorations start to appear. And to top it all off, skin regeneration is much slower than when you were 20. Sound gloomy? It doesn't have to be that way. Because since every one of us goes through the same process, we can create a smart skincare plan for mature skin and slow down the rate of these changes. Let's start with what you can do on your own, at home, before you even consider professional treatments. At-home skincare is the foundation for healthy, mature skin. It's the small daily habits that make a bigger difference than even the best professional treatment once every few months. But be warned, your skincare has to be smart, otherwise the results will be minimal. So where should you start after 50? First, with UVA and UVB filters. If you haven't been consistent with it so far, now's the time to change that. The filter works in two ways. It protects your collagen from further breakdown and blocks new discolorations from forming. What's more, research shows that regular use of a UV filter doesn't just stop damage. It actually allows the skin to repair itself. Spots can fade and your skin tone can even out. You can find more about creams with filters here. The second pillar is retinoids, retinol or retinol. I especially recommend retinol. It's just as effective, but gentler. Retinoids are the absolute top choice for mature skincare and cosmetics. They stimulate fibroblasts to produce collagen and elastin, reduce wrinkles, even out skin texture, and lighten discolorations. The effect? A comprehensive rejuvenation. You can learn how to use retinoids from this video. Save it for later. The third and final pillar is vitamin C, especially in the form of a serum. For 50+ skin, it's a great weapon against dullness and discoloration, which often appear at this age. You can find a detailed video about vitamin C right here. In my opinion, UV filters, retinoids, and vitamin C are the trio that every mature skin routine should start with. Sure, it's also worth having peptides, niacinamide, AHA, and BHA acids, hyaluronic acid, ceramides, or squalane in your arsenal, but those are extras, not the foundation. Are there specific cosmetics with these ingredients that I recommend? I wrote an ebook, Understanding Cosmetics, where you'll find as many as 140 recommendations for the best cosmetics for every budget. And that's not just vitamin C serums, but also creams with filters, day creams, eye creams, peels, and toners. And besides that, there's a ton of knowledge about cosmetics that you can draw from for the rest of your life. Check the link in the description and find out more. But a word of caution. Even if you have the best cosmetics, you still need to have realistic expectations about what they can do for mature skin. First of all, no cream or serum will give you the effect of a surgical facelift. The effects of cosmetics that have the word lifting on the packaging are much more subtle than professional treatments. Second, the effects of cosmetics are not only subtle, but also delayed over time. Cosmetics can improve hydration, which makes wrinkles less visible. They can slightly lighten discolorations, smooth out texture, and slow the formation of new wrinkles, but they won't erase or wipe away the years from your face. It's important to have a realistic approach and not throw out a product after a week because it doesn't work. It does work, but gradually. Skincare is a marathon, not a sprint. Third, don't confuse the effects that cosmetics provide with the convenience of using them. What do I mean by that? If a cream smells nice and spreads easily, that doesn't at all mean it's effective. Alright, we've covered cosmetics, but is there anything else you can do at home that will rejuvenate your skin? We need to talk about at-home skincare devices. The market is flooded with a ton of gadgets. Jade rollers, microcurrent massagers, RF devices, ultrasound, LED masks. Does any of this actually work? In most cases, unfortunately, the effects are minimal compared to professional treatments. Rollers and manual massagers feel pleasant, they improve circulation for a moment, but they won't get rid of jowls. Devices like at-home RF, which is radio frequency, or HIFU, ultrasound in a home version, usually have much less power than the equipment in a clinic, so the effects are negligible. They will have practically no effect on significant skin sagging. However, a word of caution, there is one exception. In my opinion, it's worth looking into LED masks. LED phototherapy has gained a lot of research backing. Red and infrared light at the right wavelength stimulates fibroblasts to produce collagen and can improve fine lines and skin tone. Of course, the effects are subtle and require consistency. But if you like these kinds of gadgets, an LED lamp comes closest to delivering on its promises. I talk more about LED masks in this video. Be sure to save it for later. In addition to facial devices and cosmetics, you can also take matters into your own hands and perform facial massages or facial muscle exercises. Massage stimulates circulation and lymph flow so your skin looks fresher and morning puffiness under the eyes goes away faster. Massage also relaxes tense muscles, for example, between the eyebrows, which can temporarily smooth out your features. And as a bonus, better blood circulation helps cosmetics absorb more effectively. However, on the other hand, let's not expect a massage to permanently remove deep wrinkles or lift sagging cheeks. No, that's not going to happen. Despite this, I believe it's worth incorporating it into your routine, 2 or 3 times a week. If you want to see how to perform a facial massage like this, take a look at this video. Facial muscle exercises, also known as face yoga, are another element of at-home skincare. Studies on mature women, 50+, show that performing these exercises regularly can make them appear several years younger than their perceived age. The advantages of these exercises? They're free, you can do them anytime. And third, they actually work. And what are the disadvantages? They are a subtle addition and won't replace professional treatments. You need to do them for a long time and regularly to see the first effects. And third, you have to learn how to do them. To make it easier, I've recorded a video with a 10-minute step-by-step exercise routine. Add it to your watch later list and try it for yourself. And now for a surprise. Cosmetics, devices, massages, and face yoga still aren't everything you can do for your skin at home. It's time for us to talk about supplements. At-home supplementation with the right products is another building block worth considering for a healthier appearance. With supplements, however, you need to be careful not to take just anything, blindly, and in a way that could be harmful to your health. That's why it's important to discuss taking any supplement with your doctor in person, rather than being guided solely by YouTube. Also, choose tested, high-quality products, because the supplement market in Poland is poorly regulated. Third, a supplement should only be an addition, a small building block, and not the foundation of your anti-aging efforts. But let's get to the point. What supplements for appearance do I recommend for mature individuals? Scientifically proven effects on the skin are found in drinkable collagen, omega-3 fatty acids, vitamin D, coenzyme Q10, zinc, and other antioxidants not mentioned before, including the most potent astaxanthin, but also green tea extract, curcumin, selenium, and vitamin E. In addition, in mature age, it's worth considering supplementing with vitamin C, which influences the creation of new collagen. True, it's easy to get it from your diet, but studies show that from around the age of 50 to 60, the average plasma concentration of vitamin C is significantly lower than in people aged 20 to 30. If you want to expand your knowledge about supplements for appearance and find out what doses work on the skin, check out this video later, where I talk in detail about each of the supplements mentioned here. We're moving on to the most important part of the video, the one you've all been waiting for. Which treatments are worth it and which ones you shouldn't do after 50. It's time to discuss aesthetic medicine, the whole range of professional treatments that can help reverse the signs of aging. After 50, there are a ton of possibilities, but you have to choose wisely. Not every treatment will be as effective as it is for a 30-year-old, and it's easy to get taken. And now, let's get to the specifics. So what treatments do I recommend? It's definitely worth looking into strong tissue stimulators. These are preparations that are meant to force the skin to naturally produce collagen. You often ask in the comments whether tissue stimulators make sense for someone who is 50 or 60. My answer is yes. The skin responds just as well to collagen stimulation at any age, but there are a few conditions for that. First, it's worth going for strong tissue stimulators like polylactic acid, calcium hydroxyapatite, or polycaprolactone. Weaker ones will also work, but on skin with numerous changes, they might not produce a visible effect. Second, one treatment might not be enough. The effects of stimulation, even with these strong preparations, have their limits, and even these potent preparations are no guarantee of a metamorphosis after just one treatment. So, for that same reason, you don't have to worry that they would be too strong. Third, tissue stimulators are not a substitute for hyaluronic acid fillers, which I'll talk about now. Is it worth getting fillers after 50? Absolutely. Although many people have concerns like, will I look artificial or will I look pumped up after the treatment? The key is to plan the treatments well and have them performed in a conscious, informed way. Hyaluronic acid is a substance that occurs naturally in the skin, so it's well tolerated. It provides an immediate filling and lifting effect on the tissues. For people 50 plus, it's used on many areas depending on the patient's needs. For example, the temples, forehead, cheeks, tear trough, nasolabial folds, marionette lines, lips, jawline, or chin. In the hands of a skilled operator, the possibilities are truly vast. Volumetry can be applied to practically the entire face and can genuinely help without creating an artificial look. So, my message to mature individuals is this: don't be afraid of hyaluronic acid fillers, because they were created precisely for you. An alternative to hyaluronic acid, a preparation made in a lab, is a transplant of your own fat from another part of your body to fill in tissue loss in the face. Is it a better treatment? No. The fair answer is that it's a different treatment with a different set of pros and cons and, theoretically, similar effects. You'll find a comparison of both in this video. By the way, also remember that platelet-rich fibrin is not a filler. That's a popular and often repeated myth in the beauty industry. But I'll talk more about that, so keep watching until the end. And what about botulinum toxin, or popular Botox? Is it worth it or not in mature age? Does it make sense after 50? The answer is, it depends. Expression lines at this age are often already set, visible even at rest. Botox relaxes the muscles, so it stops them from deepening and makes existing furrows more shallow, though it won't erase them completely. The effect? The face looks more rested and relaxed. But be careful. With mature skin, you have to be cautious. Excess skin and swelling are common, so the wrong dose or injection site can actually make you look worse. For example, in a 60-year-old, the forehead muscle lifts drooping eyebrows to compensate. If we treat it with too much Botox, the eyebrows and eyelids will droop. There are places where Botox works like a charm. One of them is the Dow muscle, the muscle that pulls down the corners of the mouth, and the depressor group in general. In many patients, we see this drooping, a downward pull on the mouth, which gives a sad expression. Relaxing these muscles with the toxin immediately improves the appearance and lifts the corners of the mouth. The biggest plus? Botox works preventively. Even at 60, it's worth using, because you still have 20, 30, or more years ahead to slow the deepening of wrinkles and also to work on the harmony and balance of your facial muscles. For botulinum toxin, there is no upper age limit. And now for the treatment that always causes the most controversy: lifting threads. Lifting threads are advertised as a facelift without a scalpel. Dissolvable threads with hooks are inserted under the skin, which pull up sagging tissues and create a lift, but without surgery. And what's the truth? Threads can be a valuable addition, but only in very specific situations. Let's be clear, threads provide a lifting effect that lasts for a limited time. What's important is that the patient must be a suitable candidate for the procedure so they can enjoy the effect for as long as possible and avoid visible complications. But it's still not an effect comparable to a surgical facelift. If someone expects a spectacular lift of sagging skin, threads will likely disappoint. However, for people with mild to moderate sagging, who for example don't want surgery yet, threads can gently improve the jawline contour, lift the eyebrows and cheeks. But you need to be a very specific candidate for them. The skin can't be too thick or too heavy, because the threads will give way to its weight and won't do their job. It also shouldn't be too thin and papery, because the threads can show through and cause complications. If you want to learn more about threads, save this video for later. And now we're moving on to great treatments for mature skin that, what's more, don't involve any needles. I'm talking about laser treatments. Lasers are a powerful tool for skin rejuvenation. After 50, we should absolutely use lasers, but only the right ones. What can a laser do for mature skin? It can smooth wrinkles, improve skin texture, remove sunspots, close broken capillaries, brighten and even out the skin tone, and to some extent firm the skin. Sounds great. And in fact, a well-performed laser treatment can take a good few years off your face. But there's always a but. For mature skin, lasers have certain limitations. First of all, they won't replace surgery, where you need to remove excess skin. When thinking about lasers, I would especially consider them for other signs of aging, rather than for sagging. First and foremost, you can consider getting rid of discoloration and broken capillaries, which almost every mature face has. Lasers are also great for the eye area, where the skin is thin and requires special care. Are there any lasers I wouldn't recommend after 50? It's more that treatments that are too gentle might be unsatisfying. And if someone promises you surgical-like results from a laser treatment, know that there's no chance of that. Exactly. So what about plastic surgery? Is it a hit or a miss? The topic of plastic surgery is often swept under the rug because patients are afraid of surgery. In many cases, that's understandable and should be respected. I myself would prefer to avoid the scalpel if there are other options. But honestly, it has to be said, a surgical facelift is the only method that provides a significant improvement for major signs of aging. Let me put it another way. In beauty industry marketing, you'll constantly hear about non-invasive methods that supposedly replace a surgical facelift, that they're supposedly more pleasant, cheaper, and give just as good results. Don't fall for it. If you have sagging skin on the lower part of your face, a loose neck, a turkey wattle, very saggy cheeks with jowls, then no cream, no laser, no threads or stimulators will restore a distinctly younger look the way a surgical facelift will. So what does a facelift involve? The surgeon makes incisions around the ears, often hidden in folds and in the hair, and prepares the skin. They lift it and crucially also tighten the subcutaneous layer called S-mass, which is the muscle fascia. The surgeon simply cuts off the excess skin and then stitches everything back in its new position. It sounds drastic, but modern techniques are very refined. The result isn't a pulled mask-like look, but a natural rejuvenation, because the surgeon changes the vector of the sagging tissues. The loose tissues of the mid-face are moved back up. With a good facelift, you look like yourself, just more rested, without jowls and with a smooth jawline. Is it worth considering after 50? Absolutely, especially if the skin and tissues are very saggy. Sometimes patients struggle for years with threads and fillers, spending a lot of money, and are still unsatisfied with the results. A facelift solves it all in one go. The effect is the most comprehensive and long-lasting of all treatments. It can visually take off 10-15 years, and the effect lasts for up to a decade. Of course, the face continues to age, but it will always look younger than it would have without the surgery. You can also repeat the facelift after those 10 or 15 years, if needed. And what's important, after a surgical procedure, we can, and in fact should, continue to care for our appearance in a less invasive way, using aesthetic medicine to maintain and prolong the effects of the facelift. I'll also add that a special category of surgical procedures is the eyelid lift, or blepharoplasty. Drooping eyelids are something that's practically guaranteed for all of us in mature age. They give you a tired look, take years off your life, and also lower your quality of life, because the excess eyelid skin literally obstructs your vision. In beauty industry marketing, there are many alternatives to surgical blepharoplasty, and all of them claim to be just as good. However, I can say with complete certainty that there is no reasonable alternative for this problem other than surgically removing the excess eyelid skin. If you want to learn more on this topic, check out this video. After what I've said so far, it might seem that all treatments are good for mature people. That is definitely not the case, because there are more treatments that are not recommended than those that are. I'm now going to list a whole series of disappointments, so you don't have to find out for yourself. First, drugstore miracle creams that are anti-wrinkle and lifting. Unfortunately, most creams advertised as rejuvenating for 60+ are not able to significantly improve advanced signs of aging. To put it bluntly, if you're counting on the effect of a procedure from a cream in a jar, you will be disappointed. Second, platelet-rich plasma or fibrin as the main rejuvenating treatment. Despite enthusiastic descriptions, reliable clinical studies do not confirm a significant improvement in the appearance of mature skin from plasma alone. Why? Probably because in older skin, there are fewer cells capable of responding to the growth factors from PRP, and those factors themselves may not be enough to initiate a sufficiently strong remodeling. Despite this, plasma can be a treatment worth considering in mature age, but only when it's not the only one, and certainly not one that's meant to solve all skin problems or provide a lifting effect. Third, at-home devices that promise effects like those in a cosmetology office. The market is full of gadgets. At-home radiofrequency, ultrasound, needle-free mesotherapy, and recently even mini HIFU for home use. Manufacturers tempt you, now you can do the treatment yourself instead of paying at a clinic. Unfortunately, the truth is that these devices have much lower power than their professional counterparts, so the effects are usually negligible. Fourth, plasma and skin-tightening lasers for drooping eyelids. I've already said a lot about this, but I'll emphasize again that these are not alternatives to an eyelid lift, and in my experience, they most often won't give the effect the patient expects. I also advise against carboxytherapy for dark circles under the eyes. Fifth, avoid injection preparations that have a weak effect. It's a waste of money to choose very gentle tissue stimulators or needle or microneedle mesotherapy if your expectation is a significant change in the mirror. For maintaining skin hydration and with precise recommendations, it's perfectly okay to perform such treatments. But if you were to do them against the indications, for example, because you're afraid of strong tissue stimulators, then it makes no sense because you'll be disappointed. I would also be very careful with treatments like microneedle radiofrequency and HIFU. These can be helpful and worthwhile treatments, but the indications must be very precise, and we can't allow these treatments to cause the loss of subcutaneous tissue, which is very valuable at this age. I talk about this in detail in this video, save it for later. If there are any treatments I haven't mentioned here, because it's impossible to list them all, write in the comments and ask, because someone else might have had that treatment and will share their feelings and experiences. And before we move on to the summary, I want to talk about the most important thing when it comes to skincare. Do you know what's more important than all the treatments, cosmetics, or supplements combined that I've mentioned today? Lifestyle. My dears, lifestyle is extremely important in mature age for taking care of mature skin. I'll even say it's more important than ever, because you'll see the consequences of a sleepless night, a bad diet, or lack of exercise much faster and more painfully than 20 years ago. The current condition of your skin, whatever it may be, is a result of age, genes, but also the choices you've made every day throughout your entire life. And those choices still truly matter. They affect not only how your skin appears right now, but also how it will look and feel in 10, 20, or even 30 years from now. Even if your lifestyle in the past left a lot to be desired, and after all, everyone has a different life path, maybe now you're finally at a point in your life where you can take proper care of yourself. That's why I encourage you to focus your attention not just on treatments. Take care of your diet, physical activity, good quality sleep, a healthy relationship with stress, and everything that perhaps there wasn't time or attention for in previous decades of your life. Finally, remember, beauty knows no age. You can be 60 or 70 years old and look wonderful, radiant, elegant, and classy. The goal isn't to pretend to be a 30-year-old, but to be a version of yourself that makes you happy when you think about yourself or look in the mirror. Thanks to modern knowledge, we can slow down the aging process and improve certain things that bother us, while still maintaining a natural look. And if you want to learn how to lead a truly healthy lifestyle, you must check out the video whose thumbnail is appearing on the screen now. In it, I talk about what really matters for a long and healthy life, why superfoods are a scam, and how to keep stress from aging you. Thanks for today, and I'll see you in the next video. Kisses!